This is the second part of data sources, institution-based. This presentation was developed by Thien Hancock. Slide 22. Specific systems based on institutional data sources are notifiable disease reporting, sentinel surveillance, laboratory-based surveillance, syndromic surveillance, event-based surveillance, registries, hospital-based surveillance. Do you remember them? Slide 23. You can look this memo on notifiable disease surveillance. Disease that is required by law to be reported to government authorities. It monitors disease and provides early warning for outbreaks. Specific diseases identified as being notifiable can vary from jurisdiction to jurisdiction. Slide 24. How is the information generated by notifiable disease surveillance? The information is usually provided by the health provider on a case-by-case basis to public health agency. In some settings, aggregate data on service records may be reported. Data sources are individual and service records. Collection type is passive. Slide 25. Periodicity is the frequency with which an indicator is measured. What is the frequency of notifiable disease reporting? For example, yearly, monthly, weekly, daily, continuous. Reporting should occur continuously. Report dissemination can be less frequent. Is this a strength, weakness, or neutral? Strength. Slide 26. These are the characteristics of sentinel surveillance. Limited number of recruited participants. Report detailed information on specified health events. Attempts to be generalizable to the larger population. Slide 27. The information of sentinel surveillance is generated by detailed reports on specific conditions submitted by participants. It usually includes active outreach by public health staff to capture or verify data. Data source are individual and service records. Collection type is integrated, passive and active. Slide 28. Representativeness is extent to which data represent the population and relevant subpopulations. Does sentinel surveillance represent the relevant populations? Sentinel surveillance is one of the most representative of institution-based systems, but not as representative as a population-based system. Is this a strength, weakness, or neutral? Neutral. It depends on the objective of the system. Slide 29. They are key characteristics of laboratory-based surveillance. Surveillance is based on the capture of laboratory results. Can include results from clinical laboratories, routine clinical testing, and public health laboratories, specialized labs that conduct testing that may be unavailable or cost prohibitive elsewhere. System captures results for interpretation and dissemination. Slide 30. Laboratory-based surveillance is specific, simple, flexible, and acceptable. Its limitations are timeliness, representativeness, and cost. Slide 31. If the case is expected to be captured on clinic visit, being captured in system, the period would be 28 days from exposure infection to visit. Slide 32. This situation is also found for shigellosis. Period from infected to culture positive is 10 days. Slide 33. How information is generated by laboratory-based surveillance. Positive results from specific disease tests are flagged and submitted. For example, positive smear for TB. It can also include reporting of a test being ordered, regardless of result. For example, pertussis. It uses individual records. Collection type is passive. Slide 34. What is the timeliness of laboratory-based reporting? It can take up to 2 weeks from when lab is sample drawn, especially if sending off island for confirmation. Is this a strength, weakness, or neutral? Weakness. Slide 35. Some tips about event-based surveillance. Surveillance has an organized and rapid capture of information about events that are a potential risk to public health. Information captured through informal and formal methods. Slide 36. Event-based surveillance is feasible, timely, and flexible. Its weaknesses are variable validity and representativeness. Slide 37. We can look differences between event and indicator-based surveillance systems. Event-based surveillance has rapid processes for events, cluster of disease, or rumors of unexplained deaths. Its report is immediate. Indicator-based surveillance is a routine reporting of cases, notifiable, sentinel or laboratory-based. It is based in healthcare facilities. It is weekly. Slide 38. Event-based surveillance collects reports from media, government press releases, listservs, PACnet, social media, etc. Data sources are individual, service, and resource records. It is an active system. Slide 39. Validity answers. Is the data providing you a correct result? What is the sensitivity and specificity of event-based surveillance? It varies greatly by data source. For example, rumor versus state press release. Overall, adequate sensitivity, but less specific, high false positive rate. Is this a strength, weakness, or neutral? Weakness. But this is why its purpose is to complement other types of surveillance.